Well, it's Tuesday again, and as most of you know, our In Focus health correspondent, Lino Madu, joins us. Hello,
welcome.
To In Focus, welcome.
Thank you, thank you. It's so good to be here every Tuesday and Thursday to join you guys. Well, we're looking back at some of the highlights of 2008 in health. So as you make up your list of New Year's resolutions for 2009, you might want to include a vow to take better care of your health. Here's a look back at the good and bad health news of 2008. Diabetes is often associated with obesity and lack of exercise. It can lead to blindness, kidney failure, amputation of the feet, heart disease, and stroke. In January 2008, health experts issued a warning that an alarming number of new cases of diabetes were being diagnosed every day in the U.S. There are now at least 21 million Americans with diabetes, out of a total of 180 million people around the world diagnosed with the disease. Dr. William Russell is with Vanderbilt Children's Hospital in Nashville, Tennessee.
There's no reason whatsoever at this point to think that we've reached the peak of this epidemic.
The World Health Organization reported that without urgent action, diabetes-related deaths around the globe will increase by more than 50% in the next 10 years. By February, international health experts were sounding the alarm about a severe strain of tuberculosis that appeared to be resistant to drugs normally used to treat the disease. In 2008, the World Health Organization said the number of new drug-resistant cases of TB were the highest ever recorded. Ukraine and Azerbaijan accounted for more than 20% of those new cases. The WHO warned that there could be a tuberculosis pandemic unless the disease was brought under control. In March, there was a setback in the development of a vaccine for HIV and AIDS infections. Scientists met to chart the next step in research after 2 human clinical trials of a potential vaccine were halted. The trials in North and South America, the Caribbean, Australia, and South Africa concluded that the new drug was ineffective for many patients, and the risk of getting the disease was increased for others. Dr. Anthony Fauci is a leading expert on HIV and AIDS and is with the National Institutes of Health in the U.S.
There was no indication that the vaccine was protecting against infection, and there was no indication that the vaccine was lowering the ultimate level of the virus after a person got infected.
There was an optimistic piece of news late in 2008. Researchers at Washington University in St. Louis, Missouri, announced that they had decoded the complete DNA of a cancer patient. The scientists say they hope to establish a simple blood test to help identify every cancer patient's genetic makeup. Oncologist Ross Levine says he expects the research will change the way patients are treated.
Deciding which patients should get which treatment, which patients need more treatment, which patients are more likely to have their cancer come back.
But in 2008, cholera, another deadly disease, came back to haunt the people of Zimbabwe. The United Nations say in mid-December the death toll had climbed to more than 1,000 and was rising quickly. More than 20,000 others had been infected since the outbreak began in August. People contract cholera from contaminated food and water and develop severe diarrhea and dehydration. Health officials in Zimbabwe blame the spread of the disease on a lack of chemicals used in water treatment, as well as broken sewage pipes. Lino Madu, VOA News. And as you know, cholera also was, there was an outbreak in Angola, but I think the impact is greater in Zimbabwe because of everything that we know.
And we hope they'll do a lot to control it, but then we know that even as we take as much care as we can, still the #1 killer in Africa is malaria.
Yeah, surprisingly enough, I know that HIV has this devastation around the world, but malaria in Africa kills more people than HIV/AIDS, and especially children under the age of 5. Every 30 seconds, a child dies of malaria around the world, and in sub-Saharan Africa, it's 3,000 children die, every day. So, it really has a great impact.
We've been talking about some of the diseases that are almost eradicated. Just recently, we showcased guinea worm and now polio. What update can you give us on polio?
Well, the update on polio is this. We know that there have been 4 polio endemic countries. Nigeria is the only country in Africa that has been polio endemic. We have Afghanistan, we also have India and Pakistan. So what is happening with Nigeria is recently the government has launched a great campaign to vaccinate millions of children. You know that there was a major setback in the mid-2003 when in the north part of Nigeria they had stopped vaccinating children for reasons that we will not really get into. But that was a major setback. And this year the government had really decided to move forward aggressively so that Nigeria can be polio-free.
Yes.
Okay, very
Thank
briefly, you have a final question?
Well, that is it for today. I think we will look forward to seeing you again next
Thank you.
Well, thank you so much, Lenore Madu. And as always, we thank Lenore Madu for joining us. Be sure to watch her, that's Lenore Madu, every Tuesday and Thursday for the latest health news in Africa right here on In Focus.
For more information on these stories, go to voanews.com/TV to Africa.